We also have Dr. Asghar Khaghani, who is, yes? He is the surgical director for the Spectrum Health Richard M. DeVos Heart and Lung Transplant Program. Dr. Khaghani, can you help us understand how the United States compares with other countries in terms of organ donation?
Thank you. When it comes to supply and demand, you can do so many different things. If you have thought of some products, you produce more, and possibly you move to alternative way of using some other products. But when it comes to transplantation, our options are a bit limited. There are other options, they are not as good. Like when somebody is in a heart failure, you can use artificial hearts, but they never are as good as human hearts. With kidney failure, can use dialysis, and we heard with previous speaker, he didn't even want to have hemodialysis, because nothing is as good as having a human kidney. Even biological products are not very good. There were some years ago, there was actually extensive work in the United Kingdom producing transgenic organs, and obviously that did not get to the clinical use. The best treatment for end-stage heart failure is heart transplantation. There's no doubt about that. So we have a fixed limited supply. There are a lot of donors around that are not utilized, so it depends how we utilize more of the available donors. I think the question is quite a good question to see if there are lessons to be learned from other countries. Are they using the donors better than we are using here? Before going there, I have to say that actually the USA is one of the best in the world. That's one of the highest numbers per million population. When it comes to, for example, heart transplantation, the USA is top, 7.3 heart transplant per million population. So when we are comparing the countries or continents, we have there are two ways of looking at it. Are there any sort of legal sort of changes that we need to make? By that I mean presumed consent. I'm sure you are aware of the fact that some countries have got this presumed consent in Europe, and everybody is considered to be a donor unless stated otherwise. It's sort of similar to registry here, but there everybody is a donor unless they register not to be. And this is considered to have some positive effect in terms of numbers. And when it was introduced in some European countries like Austria and Belgium in the 1980s, they compared some countries, and there were few more donors. Even now, when you look at the Euro transplant figures, there are 8 countries belong to Euro transplant, and 5 or 6 of them have got presumed consent also. And the numbers, these 5 or 6 countries' numbers, certainly is higher than the others. And Germany hasn't got their presumed consent. They are feeling it. But the numbers are lower. They have got informed consent. In this country, they have looked at it and it was reported, and some of the politicians were consulted about that, and they think that actually feasibility is not there, and also it has got really negative connotations that presuming that people are giving consent. But there are other ways of improving this crime, and one way is the Spanish model. In Spain, they have really done great jobs in the last 24, 25 years. They have introduced a different way of improving this crime, and that is improving the infrastructure, education, awareness, and publicity, which is more effective. And the more we can do that, the more donors we can create. And Spain has managed to increase the donors by like 14 million population, from 14 million to about 33, 34 million. And that is very, very important and very, very significant. So there are differences between countries, and it seems that the most effective way of doing that is related to infrastructure and the publicity and the education. There is a big room, particularly in some other countries. In the UK, for example, the UK has got the least road traffic accident victims, which is a good thing. But the numbers of transplantation was really considered compared to other countries as it is very low. And part of it possibly is that they haven't really invested in infrastructure in the last 25 years. We used to have the biggest intravenous organ transplantation activity in the world, but it's not anymore like that. There are so many transplant units, and most of our donors used to come from Europe. But now we totally rely on the local supply, and obviously there has to be a lot of investment.
Thank you.